Starting your 2 minutes time.
Yes, ma'am.
Two more pages.
Yes, ma'am. Yes, ma'am. Next page, ma'am. Yes, ma'am.
Hmm?
Yes, ma'am. I'm ready.
Organize yourself.
Yes, ma'am.
Starting 10-minute time.
Yes, ma'am.
Started.
Yes, ma'am. Hi, I'm Dr. Smriti. I'm the ST5 in the clinic today. And may I confirm your name and age, please?
Yeah, I'm Gemma and I'm 25-year-old doctor.
And how may I call you?
Gemma is fine.
Okay. Gemma, I see that you're here since you've been having brownish discharge from your down below, and also you have stopped feeling your pregnancy symptoms. Am I right, Gemma?
Oh, yeah, doctor, I'm really worried. I don't know why.
Okay. Okay. Is there any other concerns you would like to share with me?
Uh, no, I just wanted to know why I'm having these symptoms.
Okay. Okay, Gemma, I totally understand your feelings. I shall address all your concerns, but before that, can I ask you a few questions?
Yeah, go ahead.
Okay. Okay, so have you been experiencing any tummy pain?
No.
Okay, and can you tell me more about your bleeding? When did it start?
Um, yeah, doctor, actually, my last period was 8 week back, and today only I had started having spotting. I lost few spots, altered brownish color discharge, so it is frightening me a lot.
Okay. Okay. Are you having any vomiting or fever?
No,
Okay, and do you feel dizziness? Are you feeling lightheaded?
no,
Okay, any shoulder pain, shoulder tip
no,
pain?
no.
Okay, and how are your bowel, your water works and your bowel works?
Yeah,
Is it
absolutely
normal?
fine. Absolutely fine.
Okay, and this pregnancy, is it a planned pregnancy or did you take any treatment for it?
Actually, me and my boyfriend were using condom, and I don't know, it is totally unplanned pregnancy. Although my boyfriend is not that keen, but I think he will get means ready and he will be accepting this pregnancy. So far as my choice, I am very happy. I wanted to continue a pregnancy.
Okay, okay, Gemma. And okay, so were you pregnant before?
Yeah,
Any other
doctor.
pregnancies before?
Yeah, doctor. Actually, I was pregnant twice, and both the times I lost my baby during first 3 months only. It It was
Okay.
very distressing and it was very traumatic for me at that time. I
Okay.
also wanted to tell that those were not the pregnancy with my this boyfriend.
Oh, okay. 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 And okay, Emma, whatever you share here will be perfectly confidential. You don't have to worry about it, Emma. Is that okay?
Okay.
Okay. Okay. And were you offered any test for your first two miscarriages?
No, never.
Okay. Okay. And okay, did you have any previous sexually shared infections?
No.
Okay. And are you having a regular periods?
Oh, yes, doctor, my periods are regular, pretty regular.
Okay. Any other medical history of concern?
No,
Okay. Any surgeries, especially to your tummy or down below?
no,
Okay. Anything, any family history of any blood clots running in family or any other specific history?
no.
Okay. Do you have any allergies?
No, doctor, I'm not having any allergy.
Okay. Are you well supported at home?
I actually recently come to this place. My family is in the South Africa and they're staying. So my boyfriend is very well supportive me. He's very well
Okay, that's nice. That's
supportive.
nice to hear. Okay. Okay. And have you taken your cervical smears regularly and are they normal?
Actually, I was due.
Okay. But you haven't done, is it?
Yeah,
Okay. Okay. And are you on any specific drugs?
no,
Okay. And are you aware of your weight to height ratio?
it's normal.
Okay. And are you aware of your blood group?
I think it is A positive.
Okay. Do you have any reservations for blood transfusion?
No.
Okay. And Gemma, please don't mind me asking, do you smoke?
Yeah, doctor, I do smoke 3 to 4 cigarettes a day.
Okay. Okay. So if you would wish to stop smoking, I would like to refer you to the stop smoking services.
Yeah,
Is that okay,
definitely.
Gemma?
Yeah,
Okay.
definitely.
Okay. Okay. And do you take alcohol?
Occasionally in the parties, but now I will not be taking.
Okay. And any recreational drugs?
No,
Okay. And during the past few weeks, did you feel low or depressed?
no.
Okay. Okay, Gemma, thank you for sharing that information with me. Is there anything else you would like to add?
No, doctor. I just wanted to know why this brownish discharge because last time when I had a miscarriage, at that time also there was this miscarriage, this
Okay.
spotting.
Yes, yes, yes. I'll definitely address all your concerns. Can I just examine you in the presence of a chaperone? I would like to examine your tummy and down below.
Yeah.
Okay. Okay. Thank you, Emma. Okay. So, um, Emma, I see that you have come alone. Would you like to have your partner or anyone with you? Because I'll be
No,
sharing a
doctor.
lot of information.
No, no, it's okay. You can go ahead.
Okay. Because I'll be sharing a lot of information with you today. Um,
No, it's okay. You can go ahead.
okay. Okay, Emma, I have seen your ultrasound. That's your scan reports, and I must say that the report is quite concerning, and it is also not a good news, Gemma.
What, doctor? Again, this is a miscarriage because I'm worried about that only.
Uh, Actually, I'm afraid it may be another miscarriage, Gemma. We cannot confirm it with one scan. We need to repeat it again to confirm it.
Okay.
Okay. Um, yeah, so we will need to repeat the scan after a week to confirm whether this is a miscarriage or not. Are you able to follow me, Zarna?
Yeah. Why you think so, doctor?
Actually, the scan says that uh, there is a there is a sac in your womb, but we are not able to see the see your baby inside the womb. Only the sac is present and the sac is filled with fluid. So, and also the sac dimensions are quite on the higher side. Generally, with this with these dimensions, a baby has to be seen inside the womb, but it's not so in your case, Gemma.
Okay, so what next, doctor?
Okay.
If at
So
all after 1 week also the same findings will be there, what will be the situation then?
then if it's the same findings after 1 week, then it we would it is confirmed miscarriage, and we would like to we will have to proceed further with the with removal of the products from your womb, Gemma.
Oh my God, doctor. Why so, doctor? Why I am miscarrying? This is my third miscarriage, doctor.
Yes, Gemma, you don't have to worry about it. I must say that we do have a lot of investigations and a lot of options today. We will make you go through all the investigations, and if any cause is found, then we will go for the specific management. And I must also tell you that sometimes there may not be any cause found. Even if there is no cause found, I must say that there is a very good chance that you can have a live baby in your next pregnancy. Okay, can I go through your various options? What is the next level
Yeah.
of management for you?
I
Oh,
wanted to know, I just wanted to know why I am having these repeated miscarriages.
okay. Generally, the most common cause could be any genetic problems in your baby. That is, around 1 and 2 babies do have genetic problems. Other
So,
causes.
okay, other causes?
So other causes could be due to either because you are smoking, because of your smoking could be a cause, or
I'm giving you
they could,
extra 2 minutes. 10 minutes completed. Okay. Yeah,
there is,
doctor, I told you I have decreased smoking.
yeah. This pregnancy, I don't think there is anything else we can do, but you can reduce your smoking, and also we would run a few tests, genetic tests on your baby, and also various other tests for you, and some tests to check for your sugar levels and thyroid levels. If any abnormality is found, then you will be referred to the specialist team. And also for this pregnancy, to remove the products of this pregnancy, we do have three options. One, we could wait
No,
till
doctor, I will wait for that. I will wait actually. I just wanted to absorb this news that I am losing for the third time. I just can't take it, doctor. Yeah, I will wait. I don't have any issue. I wanted to know what other investigation will you be doing?
okay. So the one thing is from the after the pregnancy is removed, we can take the pregnancy tissue and give it for genetic testing to check if there is any problems. If there are certain specific problems in that baby, then
Yeah, you told doctor. You told any other test which I can undergo?
there are other hormone tests to check for your sugar levels and your thyroid levels. And there is another test to check if you have a higher tendency to for clots in your blood. If this test will be repeated twice, that is once now and again after 3 months. If this turns out to be positive in your next pregnancy, you will be started on tablets and also on injections. This will help to carry your pregnancy till you give birth. Are you able to follow me?
Yeah,
Okay.
it's really distressing, doctor, to lose babies consecutively. It's really
Yes.
distressing.
Yes, I do understand that. We do have counselors who would help you with this. They will help you to cope up with this situation to in order so that you can face your next pregnancy in a better way, in a positive way. And, and
Okay, done.
yes, mom.
Okay. What is your feedback or reflection? What is your reflection on yourself?
Now, might did take a lot of time.
Okay.
I should improve my communication skills.
Anybody can point it out her mistakes?
Yes, ma'am.
Huh, who is this?
Aista, ma'am.
Okay, Shaista. Point it out.
Yes, ma'am. She
There were
was.
sentences I didn't like it. I didn't like it. If there will be a UK role player, they will just start blasting on you. Okay, Smriti, this is for
Ma'am.
you. Yeah.
Yes,
Okay,
yes,
Shaista,
ma'am.
say.
Yes, ma'am. She was fluent and confident as well. But there is a need of more sympathy and empathy.
Yes, definitely,
And
definitely.
that is her third miscarriage. So there will be detail of previous miscarriages as well, how they were managed and how was the recovery.
No needed, not needed actually, but showing empathy, sympathy, identifying that this is recurrent pregnancy losses. Did you mention this word anytime?
No, ma'am.
Yes.
Yeah. Identify. I was telling you, oh, this is my third consecutive loss. Something I wanted to hear from your mouth, dear.
Yes, ma'am.
Okay. So this is RPL. Have you come across this terminology? One in 100 babies get, means we lose one in 100 babies, or a woman, out of 100 women, one woman will lose babies consecutively for 3 times.
Yes, ma'am.
Okay, consecutively. Okay. And do not worry, we will be managing you with tender, loving care.
Okay.
TLC. Okay.
Okay.
I will show that, tell you the sentences, what sentences will hurt as a role player. I found it is disheartening to listen from you. Okay. Anybody, any other things, Dr. Shaista, would you like to say?
Yeah, yes, ma'am. And moreover, at the end, she told, "Okay, I understand. We will refer you to the counselor, but she has to be referred to the psychologist support groups as well and recurrent miscarriage clinic.
Clinic, yes,
Uh,
RPL.
it's the
RPL.
dedicated. Yeah.
Yeah, dedicated clinic. Okay. Yes, yes, yes. Anybody else find it out any other big problem in her presentation? This is the learning way. Okay, Dr. Smriti, don't take it negatively. Don't take it negatively. Everybody
Yes,
come
ma'am.
to this, means I am here. I'm discussing this with you in a very fluent manner. Means I had come across, means come to this point.
Yes, ma'am.
Ma'am,
Okay.
shall I, ma'am?
Yes, dear.
Ma'am, it is a irregular sac, ma'am. So it is
Yes.
a miscarriage that is she should have
Yes. Yes. Yes.
told, ma'am. That's all.
Yeah. Yes, yes. Irregular sac. Basically, this is a irregular sac with 25 millimeter, no obvious fetal pole or yolk sac. No need. That is okay. I will not be going for that knowledge because many a times we might get confused somewhere, somehow. Okay. I had channelized, I had took her on a very right path that, okay, it is the same thing. Just wait. Okay. I'm getting a call.
Okay.
Okay, so that is not an issue. Identifying and guiding her, then she also took it that, okay, this means if it is a loss, then you explain me a BBN. That is good. Means BBN has been explained. Then you wanted to tell me the management of this miscarriage. Here, I was not keen to know the management of this miscarriage. I was keen to know why I am miscarrying consecutively for the 3 cycles. Okay.
Okay, ma'am.
Yeah. What are my options? How I will get, means how you will be treating me for this these things, okay? And the next will be mm, then the management, okay? Because I already had 2 miscarriages which was managed. So here's something like that, okay? So you are having 3 options: either to wait and watch, or use medical medicines to end the pregnancy, or directly
Okay.
going for a surgery. So these are your three
Mm.
options. Do you have any preferences? Just tell her in one or two sentences what are her options. That is what we
Okay.
needed. Now my biggest concern is okay. Okay, whenever I will upload this task on YouTube, just listen how many times you use this word okay.
Okay,
You
ma'am.
just count it out. Okay,
Mm.
many times, many times you had used. Just wait, okay. I am having a call.
Ma'am, you are not audible, ma'am.
Yes, yes, yes. Just wait. I'm getting calls actually. Okay, so this okay was used many times, so you can cut short this okay.
Yes,
Now
ma'am.
coming to your feedback, okay, a gross feedback, you need to improve on communication with patient domain very strongly because you wanted to impart what information you wanted to impart, so that is not the way RCOG wants MRCOG part 3.
Mm.
It goes by my way. Okay, I will be channelizing you, so understand what exactly you need to know. In the beginning you started on a very good note, introduction, setting aim, setting agenda, acknowledging that I am anxious. Okay, when I said no, I wanted to know I'm worried about it. So
Mm.
your answer was okay.
Mm.
It sounds very rude because I am worried, and
Mm.
saying okay sounds very rude. Acknowledge here, yes, I can see you are worried. Let me
Yes,
give
ma'am.
some time. We will discuss what you are having.
Mm.
Is it okay before that if I will ask you few questions?
Yes, ma'am. Yes, ma'am. Yes.
Yeah. Just wait. I am having one. मम्मा रेखा दीदीला पाठवलं आणि तिच्याकडनं घेऊन घे.
रेखा दीदीला
हा, ते मला डायरेक्ट नाही पाठवता येत होतं. ठीक आहे.
आज मम्मी ने आपको फॉरवर्ड किया, आप पेमेंट कर लो.
Sorry, dears. First part was complete, 1 minute time, well within time. Okay,
Yes,
acknowledge if the
ma'am.
patient is having anything, if the patient is anxious, if the patient is worried. Please acknowledge that feeling. Yes, I can see you are anxious. I can see you are worried. Uh, I will be there. We will discuss your case. Will it be okay if I ask you a few questions before that? Then you are going to ask her the details. Okay. History, in the history, initially you were quite targeted. Then I don't know why you went into so much of detail. And that okay must have took almost 1 minute 30 seconds of you. Okay. Uh, Fever is not important here. Below, down, something like that. You can ask any what means you are having bleeding. You can say that vaginal bleeding or vaginal spotting. You can use
Mm.
that terminologies. They are okay with this. Nowadays,
Okay.
they don't want exact layman language. Okay,
Okay.
with this newer media and everything, they are having this vagina, vulva. They are aware. Okay,
Mm.
fever is not relevant. Then the history, I will not say anything. The smear history when you took actually. Oh no, I was due, but then I was pregnant. Okay. So here you can just tell because you do not want these points to be missed out. It is considered under patient safety.
Mm.
Once the pregnancy event will be completed, we will offer you smear test.
Okay. Mm.
Okay. So then and there only you address that concern. Then and there only.
Okay.
Uh, Okay, then smoking, NHS smoking examination here is not needed basically. Per se, examination is not needed.
Okay. Okay. Mm.
Hmm. Per se, examination is not needed. You just explain her a ultrasonography report. You followed a template of BBN, but before following a template of BBN, check her background knowledge, whether she
Okay.
is aware about the report. Here, the report was not there, but check whether she is aware about the report. If
Okay.
not, then only go and discuss. If it is, I am aware, then it is not a BBN.
Okay. Mm.
Okay, so that simple
Okay.
thing you have to remember very normally. The
Mm.
sentence what I feel was very means harsh. Okay,
Mm.
you don't have to worry about this pregnancy. Why, dear? If I'm having a miscarriage, and if you are telling this sentence, this will be taken back very strongly by a lay examiner
Okay.
because we are Indian. Most of the time in India, we do have a habit of discussing with this bluntness.
Mm.
You don't have to. You don't have to worry about this pregnancy.
Mm.
When she was saying, "What are my options and how you are going to prevent this?" Okay, so that sentence you used, this is a big sentence. We will rephrase it. Okay, we will rephrase it. Then the another sentence was, uh, yes, it has happened because you are smoking. This is direct allegation on me because it is my mistake. Because of me, the baby has been aborted. Baby has been miscarried.
Okay.
Okay.
Mm. So how should I?
And there is one more sentence. There is nothing you can do. Okay.
Okay.
So these are the sentences. This will come up with practice only.
Okay.
Find out a very good study buddy. The first thing. Whenever you are using this kind of harsh statements,
Mm.
uh, means rephrase it. When I said that I am worried and I wanted to know about options, yes, I will be discussing the option. Yeah, uh, yes, we will be discussing at this time. We do have an option of sending the tissue. Rather than saying at this point we can't do anything, I will say here, yes, at this point what we are going to discuss, what we are going to do, we are going to send this tissue sample for a genetic test to see whether there are any genetic abnormality. Hmm?
Okay.
If
Mm.
it comes out positive, then we will be screening both of you
Mm.
because it is one of the commonest abnormalities seen in miscarriages. Then there are other options also, other things also which might be a reason. Hmm? So these
Mm.
are the option. These reasons will be age. What we have seen, age, increasing age. Then high weight to height ratio. Thirdly, it will be a lifestyles. Okay, sometimes it's a lifestyles also. Fourthly, a ability to form clot, either it is genetic or acquired. That is a thrombophilia, acquired thrombophilia, or genetic thrombophilia. Okay, this
Mm.
if there is a history, once your pregnancy will be completed, we will be screen you for that 12 weeks from here onward, not now since you are pregnant. Sometimes the abnormal shape of a uterus also leads to this. So we will be
Okay.
evaluating you with the help of spatial test. Just need to tell her special test. And with these things, we will try to find out what could be the probable reason to have a recurrent pregnancy losses. Because once you had mentioned, once you have identified that this is a third abortion in a row, you are going to explain her about RPA. Hmm? Once you have done this, the next option will be, the next thing will be the management of RPL. So most of the time, a tender living care. That means a 3 out of 4 women will carry a healthy pregnancy, healthy baby in her next pregnancy with tender loving care. This is what your sentence should be. And if something comes up positive, we will target that therapy in your case.
Okay, ma'am.
So early booking, support, counseling, support group is very important here. You mentioned about counselor, you mentioned about support group, but it is very important here. Okay.
Yes, ma'am.
Anybody is having any question? Shall we go through the answer key? It's already late, getting late. Okay. So introduction, situational awareness, aim, GP letter with regression of pregnancy symptoms and spotting PV, which you acknowledged very nicely, dear. Concerns, ask one by one. In the beginning, I might not be having any concerns, but once I will be aware about the report, I may be having multiple questions. Setting agenda, closed question. Okay, in the beginning you asked me closed question, avoid closed question, ask me open questions. Tell me in detail about this pregnancy. Okay, when was it, when was the last pregnancy, show. Then red flags, fainting, red flags, you asked previous pregnancy details, outcome. And when I said you that I lost previous 2 pregnancies, rather than saying okay, oh, it must be a difficult situation for you. Are you coping, miss? How are you coping after that event? Are you comfortable now?
Okay, ma'am.
Yeah, because miscarriage is taken as one of the means distressing event in their life. So whenever any distressing event is there in their life, how are you coping? Do you find any difficulty to cope with this situation? Can I offer you counselor? Hmm? Then acknowledging this previous obstetric history, assuring her about confidentiality. You assured me about confidentiality, but you didn't acknowledge. Family history, similar miscarriages, blood clots, you asked. LMP smear, contraception, guide for contraception. Okay. If it is unplanned, okay, once we have completed this pregnancy event, I will guide you for a effective contraception. Thyroid, diabetes, you asked me. Treatment, you asked me. Allergy, you asked me. Social history of occupation, smoking, alcohol, support, BMI, you asked me. Mental history can be skipped. Okay, here if I am giving you straightforward answers, this is a big history, so you can skip here. Hmm? But if
Ma'am,
you think
what was it that I didn't acknowledge, ma'am? I didn't understand that.
uh, previous to obstetric, previous to losses,
Okay, okay,
because it's a traumatic thing for me, so you have
okay,
to
ma'am.
acknowledge that. Oh, it
Okay,
must be difficult for you. Okay. Now, examination is not needed here. Checking her background knowledge, explain her that bleeding in early pregnancy can be a sign of miscarriage. So actually, in the exam, in the task, they had not given a ultrasonography, but I had included here. Once you utter a word TVS, they will offer you a scan. Okay. But I had provided here in the beginning. Okay. So that interpretation of report. So BBN, you had managed to do a BBN. It can be more smooth. With practice, you will able to do that. Okay.
ma'am.
Identify it as a recurrent pregnancy loss because 3 miscarriages in a row. Again, you have to ask her, have you heard about this terminology? Because recurrent pregnancy loss, everybody might not be aware. Yes, 1 in 100 pregnancies who are trying for babies. Emotionally draining, overwhelming experience. But do you know, with the help of tender, loving care, 7 out of 10 achieve a way to get pregnant and deliver a healthy baby if all tests are normal. Sometimes we found a reason for recurrent miscarriages. In other cases, no underlying problem can be found because not every time we will get a reason. There are number of factors which plays a part in causing recurrent miscarriage. Increasing age of a mother or father, a condition known as antiphospholipid antibody syndrome or APLA or sticky blood syndrome, what they are calling, which is acquired or acquired and sometimes a genetic conditions where our ability to form a blood clot is increased could be a cause for recurrent pregnancy miscarriages. Genetic abnormality in the mother and the baby, sometimes which will carry on in a developing baby. Developmental genetic abnormalities in the baby, not in the mother and father. Infections, certain infections are more prone to cause in miscarriages. Shape of the uterus and medical conditions like diabetes and thyroid. So what we are going to do, we are going to offer you a ultrasonography to see the shape of the uterus. Diabetes and thyroid will be ruled out. Also at the same times, we will be sending the products of conception or pregnancy tissues for a genetic typing and a tissue testing. Once we will completed this pregnancy event, we will screen you for a genetic or acquired condition of blood clot formation, that is APLA and thrombophilia. Hmm? With the, if all these blood tests, we will discuss this. Okay, we will discuss this. If APS is diagnosed on two occasions 12 week apart, then we will offer you a low dose aspirin and heparin. Okay, a blood thinner from the early pregnancy, and you will be booked under a consultant led care unit. If there will be a genetic abnormality seen in the baby, a mother and the baby, you both will be offered a genetic counselor and genetic testing, and depending upon that, we will offer you further management. Then test for the abnormalities of the shapes and the infections will be uh, USG. Okay, so basically a specialized USG will be offered to you. Then if we will able to find out the cause, then we offer you treatment according to cause, like blood thinner along with aspirin, because this is a big station, you might not be able to complete it. You just need to tell her all the investigations and simultaneously options. Genetic counseling, folic acids, early means folic acid 400 microgram will be started. Do you wish to discuss in these details? If yes, then only go in detail. Your booking will be, you will be considered as a high risk pregnancy. Your booking will be under the consultant led care unit, and we will be monitoring this pregnancy till term with the help of extra help USG, and we'll discuss mode of delivery nearing term. Any other concerns? There is a question in the exam, okay, in the exam which asks IVF. Yes, if any genetic abnormality seen, then we will definitely discuss the options of prenatal genetic diagnosis and IVF. Uh, Only in genetic problems. Otherwise, if everything is normal, then IVF and genetic testing is not offered. Women who have supportive care from an early pregnancy assessment unit, especially RPL dedicated clinic, from the beginning have better chances of successful birth. Now, regarding the miscarriage, now this has been completed as a part of RPL. Regarding the treatment options, we can wait and watch. Tablets for expulsion or surgery. What are your thoughts? All the options with pros and cons, but most of the time with these things, you might not be having in detail that much time. So if you are having time, you can explain, or you can just explain her. These are the there are multiple, there are pros and cons of each options. What option would you think I should explain? Because you are not having that much time, so at least the options which is suitable in her care, she will definitely give you a clue and you'll discuss that. For couples where no cause for recurrent miscarriage has been found, 75 out of 100 will have successful pregnancy with this care. It is worth remembering that the majority of couples will have a successful pregnancy the next time, even after 3 miscarriage in a row. So that is positive enforcement, positive counseling. So I will arrange ultrasonography as of now and follow up. Ultrasonography, actually, no, we are going to arrange patient information leaflet, a blood test, and what close the loop? Close the loop means offering her a counselor, documenting, giving her this information regarding RPL, patient information leaflet regarding RPL. Miscarriage Association is a support group. She can be in touch with them, okay, and writing back to a GP, because we are having a GP letter. So that way we are going to close this task. Domain scoring. This is, I think, patient safety, basically confirming the identity, understand the impact of loss. She is at risk of depression, relationship breakdown, and take appropriate steps. So offering her a counselor and help whenever she is desire of. Drug allergy demonstrates safe prescription, management of future pregnancy, risk of recurrence, aspirin, heparin if APLA positives in next pregnancy, consultant-led booking in the next pregnancy, avoid COC till she will be complete, means she will be under evaluation now. Okay, till she will be under evaluation. You can advise her contraception also once she said that these are unplanned pregnancies. APLA test after 12 weeks, management of APLA in next pregnancy, understanding the limit, communication with colleague. Basically, you have to involve your senior, you have to involve your counselor, local support group, hematologist, and GP. GP will be a part of this stream. Good history, nature of miscarriages, that is recurrent miscarriages. Request notes. If you want, you can access her previous notes. What investigation you are going to ask to come to a diagnosis of recurrent pregnancy losses is very important. Ultrasound scan and full blood count. Blood group also. Communication with patient and families. Ability to build a very good rapport with the patient, inform the patient of the ultrasound findings, that is BBN, explain management, expectant medical and surgical, pros and cons of options, whatever suits are better. Follow up, okay. Discuss investigation for recurrent miscarriages, ability to explain and justify the investigation, elaborate the risk factor, ability to give her advice, rectify risk factor, empathetic way and support group. You have to be very empathetic rather than saying, it could be because you are smoking. I will say what we have seen means a woman who are smoke means the sentence here will be this. Recurrent miscarriages are caused by multiple factors and smoking is one of them. You are not blaming her, but you are telling her that this is one of the reason.
Okay.
Okay, you are not blaming her, but you are explaining her in a very sensitive manner that we have found it is associated with many factors. Smoking is one of the factors.
Yes.
Okay, this way you can tell her, and so you have to improve on your communication skill, dear.
Yes.
Anything else you wanted to ask? Anybody wanted to ask? No? Okay, so shall we stop here?
Yes. Thank you, ma'am.
Thank you, dear.
Thank
Next week, with 2 more tasks, we will come up.
Thank
Thank
you
you
so
for
much.
attending. Yeah, thank you for attending. I'm leaving the